What's really the state of the fortified food sector, and what should be on the radars of our member readers, the global development professionals in this area? What interesting conversations have you had here this week in Arusha?
It's been a long road because nutrition is not like buying a bed net and trying to combat malaria or giving a child a vaccine. It's more complex. It's more, you can only measure it over a generation, but we know that it works. And so what has happened today is that we know that we have reached close to 1 billion people with fortified foods. We know that we've been able to construct very innovative partnerships that bring on board the private sector. Given that the private sector is the primary producer of foods that are consumed by ordinary people, particularly poor people, foods that are available on the marketplace. And working with the private sector is therefore a priority for us because we have to work with them in order to make sure that those foods are nutritious, that they promote the health of the people that consume them, and also they're affordable and accessible. We have to work with civil society because we have to change social behavior. And we have to work with governments to also improve the policy and regulatory environment, particularly in relation to the issues of food safety and food quality and assurance. So I think that there has been, what we're seeing now after almost 10 years in the implementation phase is the positive evidence that is emerging that in many parts of the world there is now data that is demonstrating that improvement in the health of populations, including vulnerable populations.
Now, you mentioned partnerships there, and there's an increasing number of partnership platforms such as GAIN. As we look towards moving from theory to practice on the SDG implementation side, I just wondered what your thoughts on whether this is an effective strategy for the future.
So my view is that it is a catchphrase, and it's fashionable to talk about partnerships. Not all types of partnerships work. So there are certain criteria that underpin successful partnerships. A greater openness, a transparency, an idea of what is the value proposition you bring to the table, a clarity of how you deal with conflicts that will arise in the case of these. There's no perfect science in this in terms of partnerships. And so a lot of them are designed and are successful based on the people that are around the table. There's not one size fits all. Many of the most pressing challenges we face that the SDGs are trying to target are in sectors that, in which partners can be very conflictual in the way they want to tackle it. The role of the private sector is one example. And our view in GAIN has always been that the 60 to 70% of people in the world, poor people earning less than $4 a day, are buying food in a marketplace. When we talk of the private sector, who are we talking about? It's not just the big multinational corporations like the Unilevers of this world. They're also national players. They are rural players. In my mind, subsistence farmers are part of the private sector. We don't recognize that now, but they are entrepreneurial. They feed themselves. So we got to look at what are the barriers stopping, for example, subsistence farmers from becoming successful smallholder farmers and being part of a viable community where incomes are raised, where nutritious foods are produced, and we know from all the evidence that is available, empirical evidence, that the majority of people who produce food in the smallholder farmer space are women. We know as a fact that the highest levels of incidence of malnutrition are in the families of these subsistence farmers who are mainly women who produce 60 to 70% of the food we consume in Africa or Asia. And we know for a fact that if we improve the incomes of these subsistence farmers, then all the evidence points to them investing their increased incomes in the health, education, and nutrition of their children. So they are a centerpiece of solving the challenge of malnutrition. And I think these are things that we've got to look at. What are the barriers that stop a marketplace from operating in a more efficient way? With agriculture, which is a key part of solving nutrition, we know it's legal title to land. We know it's about access to finances that allow these farmers, mainly women, to buy seeds or to be able to install irrigation, access water. We know is that how would we create the marketplaces for nutritious foods that allow them to get the best price? How do we harness technology in order for them to negotiate and bargain with the middlemen who will be buying their products? So and these are very complicated supply chains, and therefore the approach cannot be simplistic, and it cannot be solved by one player. And therefore these partnerships that embrace innovation and embrace in transparency will be key as success factors.